Good morning, Nigeria. Good morning, Africa. Good morning to the rest of the world. You're welcome to the conversation where we bring you informative, educative, and entertaining content from across Africa. And today, it's Wednesday. I'm Merciful Ajinamo.
And I'm Ade Suwasi. Good morning and welcome to the show.
How are you doing today,
Very
sir?
well, thank you. How are you?
Good, good. Before we bring you development across Africa, here is the quote of the day. That is Vince saying it's the difference between a successful person and a failure is definitely the presence of willpower. So if you're doing something, you have to put in that will, that energy, that drive, that enthusiasm.
Yes.
What do you think about it?
Obviously, because the willingness to do something is what actually takes you ahead and takes you forward. So if you're not willing to actually do something or go extra mile, just the will is what it is. Once you have the will, it's as I say, once there's a will, there's a way. So once a will, you find a way to do things and then you become successful at it.
All right, we move ahead to development across Africa. And the beginning of the story here is Anthony Blinken advising Ethiopia on humanitarian disaster. United States Secretary of State Anthony Blinken on Monday, in a phone call with Ethiopian Prime Minister Abiy Ahmed, urged him to address what he described as an impending humanitarian disaster and for troops from Eritrea involved in the Tigray conflict to be withdrawn immediately in full and in a verifiable manner. Spokesperson of U.S. State Department Ned Price disclosed in a statement on Monday. According to Ned, Blinken said Eritrean forces and Amhara regional forces in the Tigray region are contributing to the growing humanitarian disaster and committing human rights abuses. The secretary also stressed the need for all parties to the conflict to end hostilities immediately.
Yes, moving away from that to South Sudan, where the United Nations Security Council has warned that the widening political, military and ethnic divisions in South Sudan are leading to multiple violent incidents between the main signatories to last year's ceasefire, the possibility of renewed war, and nearly 100,000 people facing famine-like conditions. In an 81-page report to the United Nations, experts said that a slow pace of reforms by President Salva Kiir's government and political disputes and disagreements, over how to implement the February 2020 ceasefire and a 2018 peace agreement have led to frayed relations between Kiir and first Vice President Riek Machar. According to the panel of experts in the report, discontent within Kiir Sudan's People's Liberation Movement and his power base in the Dinka ethnic group over his handling of the transition has led to calls for new leadership.
All right, move over to Burundi, where the prisoners were released to stop overcrowding. A total of 5,255 inmates, which is 40% of Burundi's prison population, will be released in the coming weeks. 3,000 will be released and another 2,000 will have their sentences caught. While addressing the 1,000 inmates who had been freed at a ceremony in Bujumbura prison, President Evariste Ndayishimiye said that what crippled the economy is the crimes and offences committed that were not sanctioned by the state, and hinted that it has given the impression that committing crime was a sign of bravery. He therefore warned detainees against a relapse.
Okay, and then the last story on development across Africa this morning is on the World Health Organization saying the theme for this year's vaccination week is Vaccines Bring Us Closer. According to the WHO Regional Director in Africa, Dr. Machisido Moeti, the theme is a reminder that vaccines have power to fight disease, save lives, and bring people closer to a healthy, safe, and prosperous future. Machisido also noted that the gains through immunization have been significant in recent years. In an historic milestone, the WHO African region was certified free of wild poliovirus in 2020, where over 40 African countries have eliminated maternal and neonatal tetanus.
I really do hope that a lot of African countries and their citizens, will take this vaccination very serious, so we can scale through, especially in Africa, talking about the second wave coming to an end and not necessarily going to a third wave.
And I think the vaccination is not necessarily just for coronavirus. It also has
other
ailments. Looking at vaccination against polio, vaccination against malaria, typhoid and all of this stuff. So yeah, vaccination requests across all, and I hope people just go out and just get vaccinated against
All right, talking about vaccination, is that time I will bring you the coronavirus COVID-19 update from across Africa on the television.
TOS TV Network mobile app is now available. You can now catch up on our breaking news, stream our programs live, watch out for the latest update on sports and politics as they unfold. You can also get notifications for our upcoming programs and events. All these on our TOS TV Network mobile app, available on Apple Store and Google Play Store. TOS TV News from Africa by Africans.
Being a journalist means in-depth analysis that unravels hidden truths, that question the status quo and fact-checks government.
These criminal elements hiding under the cloak of surveillance contractors are the APC elements.
Do you have facts to prove that? Being a journalist means waking up every day with a burning desire for peace, equity, and justice for all citizens.
We're being told that the choice you have is to take the lesser of two evils.
It means patriotism via the prism of objectivity and accountability. It means giving my platform to the masses to discuss issues that matter to them.
Some of them, if they bring budget, and the budget they look. Some of them sleep. They're going to ask how much you are on. I have it.
Thereby shaping government policies and laws. My name is Osasu Igbenegbu, and I am the People's Journalist.
To the conversation showing on your digital first Pan-African news network, TOS Television. Don't forget you can always be a part of it by joining our social media community at TOS TV Network on Facebook, Instagram, Twitter, and of course live stream on our website www.tostvnetwork.com. And don't forget to subscribe on YouTube as well so you don't miss out on our amazing content. It's that time I will bring you some of the headlines from across the national dailies for this morning. And we'll begin with the Blueprint newspaper. From the very top, MTN slashes data price in South Africa. Mom on Nigeria. That can be found on page 23 of the Blueprint. Underneath that story, we see UBA leads as banking sector sacks over 8,000 workers in 2020. That can be found on page 23 as well. And just underneath the Blueprint header, there is federal government rolls out digital switch over tomorrow. That is tomorrow, Thursday. And the rider underneath says decoders to create 50,000 jobs, TV 200,000, film 400,000. That's coming about job creation right there. Another in that story, we'll see Blueprint newspaper has come of age coming from Governor Sule. That can be found on page 5. The very conspicuous headline there says Senate on worsening insecurity. It's shameful Nigeria is on fire. We have a couple of riders in the story, and the first is orders massive recruitment into the military police. A National Assembly meets Buhari summons service chiefs. Buhari wants AFRICOM headquarters relocated to Africa. And 7 Benue IDPs killed in their sleep. FHC set ablaze in Ebonyi. That's on page 7. Mob kills kidnapper. Raises Sokoto DPO's office. And then we see darkness looms if we don't end attacks on citadels of learning coming from the former Vice President of Nigeria, Atiku Abubakar. That can be found on page 7 of the Blueprint newspaper. On the other picture of the day there we see IPOB, editors accuse NBC of double standards over threat to China's TV. And that can be found on page 7. RMRDC committed to reviving Nigeria's textile industry, coming from the DG, can be found on page 8. Bandits release video of pregnant student abducted in Kaduna State, and can be found on page 5. Extremism allegations, Christian clerics back Buhari on Pantami, that can be found on page 8. And sugar war, NPA backs Dangote, bans sugar importation from FTZ, and that can be found on 23. All of these stories can be found on the Blueprint newspaper for today.
All right, moving away from the Blueprint newspaper to the Daily Trust, starting from the very top as well. Stop sharing photos of soldiers killed in action, Army pleads. Electricity tariff review, consumers experts urge federal government to soft pedal. And then to the very main headline on the Daily Trust newspaper on the issue of insecurity, Buhari seeks U.S. help once AFRICOM relocated to Africa. No partnership can solve Nigeria's problems. That's coming from the UK minister. Senate calls for sophisticated arms, more security personnel. Declare state of emergency, reps tell president. Strengthen ties with neighbors, bring mercenaries. That's coming from experts. And then just underneath the picture of the day there, IPOB attacks. Wike imposes curfew on Rivers boundaries. Police dismiss 3 officers for extortion. And I'm not looking for a wife in public domain. That's coming from the Luo. And then the last headline on the Daily Trust newspaper this morning says, El-Rufai, why I reviewed my past position on negotiating with terrorists. All of this you can find inside the Daily Trust newspaper.
And over to the Daily Times newspaper very quickly. The beginning is how to check drift to anarchy by Atiku Lawan, Sariki, Tinubu, Zulum, others. That's the very gaping headline there can be found on page 2. The very top story there on the beginning of the newspaper is Folio Communications loses board member Dr. Victor Alaufin, and that can be found on the Daily Times as well. On the picture of the day we see 3 headlines. The first is insecurity. Growing insecurity, Buhari asks US to relocate AFRICOM headquarters to Africa. That story can be found on page 3. And on the NUC budget, Reps panel discovers NUC's duplication of annual budget. That can be found on page 7. And talking about Innocent Chukwuma's funeral. Innocent Chukwuma's burial program begins on Monday. That particular story can be found on page 5 of the Daily Times.
And to the last newspaper we're going to be looking at this morning, that's the Nigerian News Direct. Lawan assures passage of PIB in May. And then OPL leases Buhari's decision shows commitments to due process in oil sector. That's coming from the BMO. Q1 results, EcoBank declares 40.3 billion naira PBT. That story is on page 2. And then to the main headline on the Nigerian News Direct, defaulters, ICPC drags 2,000 firms into tax net. Owosanwoye, that's the story is on page 3. And then underneath the picture of the day, Abiodun makes case for more passport offices in Ogun State. Extortion, Ogun police dismiss 3 officers. Buhari urges US to move Africa Command headquarters to continent, that's to Africa. And then APC will roll Nigeria beyond 2023. Tinubu after meeting Buhari, Zulu. I won't allow paid agents to tarnish my image. That's coming from the Minister of Communication, Issa Pantami. And then the last headline there, surrendering to criminals, not an option. That's the governor of Kaduna State, Nasir El-Rufai, is insisting on that one.
We have so many stories for the Nigerian newspaper daily this morning, and I think you should just go grab a copy of it just to get the details and just get information on what is trending on this space. That's the much we can take on newspaper review segment for the show this morning. And don't forget, you can always be a part of it by following us across all our social media channels and handles at TOS TV Network. We'll go on a break now. When we return, we'll be bringing you what's trending on social media.
Welcome back to the conversation here on TOS Television Network, and it's about that time where I take you through what has been trending on social media in the last 24 hours. So before we get into all of that, I always say you should be part of the conversation. Just join the TOS community, follow TOS TV Network on Facebook, Twitter, Instagram, and also subscribe to TOS TV Network on YouTube so you don't get left out. And also you can stream the conversation and other programs on our website, www.tostvnetwork.com. Now, back to the issue of what's trending on social media. Now, Remi Tinubu, wife of, Senator Ahmed Tinubu, the APC national leader, has been trending on social media in the last 24 hours over a comment she made in response to Senator Smart Adeyemi of Kogi State, who complained, Senator Smart was complaining about the worsening state of insecurity in the country, and then Remi Tinubu, I don't know, she was trying to make light of the whole situation. In response, asked if he was a member of the PDP, and so Nigerians have, taken to social media to express their disbelief and, disappointment basically over the statement that she made. And I'm going to read out a few tweets in that regard for you. The first one is from Sadiq Tade. He says, "Smart Adeyemi, this is the worst instability the country has suffered since the Civil War. Remi Tinubu, wife of a potential APC presidential candidate. Are you in PDP?" Basically saying the country is safe for APC. Tinubu's family is politicizing insecurity. And then this is from music producer Sam Clef. He says, "Make una no spoil mama dream for becoming first lady. Remi Tinubu tackles Senator Adeyemi, who is speaking out for complaining about insecurity. Remi Tinubu, are you in the PDP? Wolf in sheep's clothing." And then this is from our First Ladyship, and she says, "I won't pay attention to the divisive Remi Tinubu. I'll focus on this wise man, Smart Adeyemi. I may not be his fan, but you can tell he wasn't speaking like an APC party man. Forget politics, there's fire on the mountain. Nigeria is battling stage 3 cancer." And then the last one is from Wari Pamosami, and it says, "Remi Tinubu is a shame of a woman. National issues are being discussed and brought forward for urgent solutions to be given. All she is concerned about is her husband's dirty APC political party. She's isolated from the suffering of Nigerians and doesn't care who's dying and suffering."
I think from all of this tweets, you can tell that from the part of Nigerians, it's important that when issues are being discussed, we should when national issues, especially when it comes to insecurity, are being discussed, we should speak not based on the fact that someone is in a party or another is in another party. We should address it as one people. So we had Smart Adeyemi, the senator, who was complaining about insecurity, and he was very vocal, and he spoke out, and we're seeing the response from the wife of Senator Paula Ahmed Tinubu.
Who's a senator in the country?
Yeah, and asking what side, what party. I think it's very inconsequential.
It is.
And this is the reason why she has been trending, and Nigerians say, look, I've hardly seen a tweet that's not supporting, even if they're supporting it, the clauses. Can we pay attention to what is the issue on ground, which is the insecurity? Because really, across all of the dailies, we're seeing bad news, insecurity, kidnapping, and banditry. This is not the time that we have to start talking about party or not party. I think we should just focus on all of this and make sure the country is moving forward.
I quite agree with you. Not quite agree with you. I think I agree with you, like, to the very last extent, because as the first person said, there's no point politicizing insecurity. It's a matter of national concern. Every Nigerian, home and abroad, should be concerned about the state of security that we have in the country at this point. I mean, it's damning. It's getting worse by the day. And I think you just sit down, you feel like this thing is getting closer to me, getting closer to home. And then somebody is coming out and say, forget the fact that he's also, a voice of authority in the country because he's a senator in your state, and that he's also maybe in an opposition party. But he's coming to talk about the state of insecurity in the country. Whether you have issues with his party or you have issues with him, contrasting opinion, the issue that he has brought forward is a concern for everyone who's a Nigerian, right? And I think, like you said, I think we should have been addressing it as Nigerians first. I think we need to get to that part where we all think as Nigerians first.
Before
we
religion,
tribe, party, politics, whatever. We cannot begin to politicize security at this time, you're saying, oh, because whoever is in power at this time is a member of the, All Progressive Party, then it's not my business. Then when somebody who's in the People's Democratic Party or other party is in power, then we can give our support. That's not going to work at this point because you do not know. They could be knocking at your gates the next minute, right?
Definitely.
So basically, I don't know if she was trying to make a joke or she was being sarcastic. But we didn't see it. We didn't take it lightly.
And with all of the response, we know that Nigerians do not take
I'm
it
quite disappointed at the whole thing because she was a sitting two-time senator in the country. You should know better. You're part of the people that made law and upholded the laws in the country.
And all of this, it breeds room for people to begin to see that, oh, are you trying to say it's only the members of the APC that are safe?
Like,
and that's the close that people begin to think, oh, what are you saying? So if you're not in APC, that means you're left to the whole, the tenet of insecurity and everything.
Because it's like this person is saying, look, this is the worst that we have seen. Because I said the same thing yesterday. I feel like I said this is the worst that we've seen in the country so far. And then this person is saying that, and then you as a senator is saying, are you in the PDP? It's like, are you in the PDP? Oh, that's why you're feeling the brunt of it. Because that's how I interpreted it. Oh, if you were in the APC, you wouldn't have been feeling this way. She gets it. Which is quite sad. And then if going by what the speculations and everything, because we've always said that Bola Ahmed Tinubu has not said he's coming out for presidency. Like there's been hints and speculations everywhere, but he hasn't actually come out to say, look, we're running for president. But if he's running for president, that's a potential first lady in the country. Thinking about, the insecurity situation in the country like that.
And it's a red flag for Nigerians, for people who would have, if he came out to, state his choice of coming off presidency, who would have supported him, would back down. Because from all of this, it's a red flag.
Exactly.
Definitely.
All right, we all hope everyone takes, Nigeria seriously. That's how I'm going to say. It's like some persons don't take Nigerians seriously. So when we raise issues, it's not my business. But it is your business. Because, as I said earlier, it could be knocking on your gate the next minute, or the gate of a family member or someone really close to you. So we all have to think as Nigerians first before we start to, think about other issues as well. Okay? All right, that's it for what's trending on social media here on TOS Television Network on The Conversation this morning. We'll go on a break now, and when we come back, this is the time to take you on the big story.
North to South Africa, East to West Africa, TOS TV Network is your digital-first Pan-African news network, bringing you news from across the continent. Visit our website www.tostvnetwork.com and follow us on social media at TOS TV Network on Instagram, Facebook and Twitter. Watch us on television, channel 138 on TSTV Africa. North to South Africa,
Thanks for staying tuned on The Conversation, showing on your digital first Pan-African news network, TOS Television. It's that time we will bring you the crux of the program. That is the big story. According to reports, Nigeria is losing more than $1 billion annually to medical tourism. This is as tens of thousands of Nigerians travel outside the country in search of the best medical treatment. Although this nation's Ministry of Health has on several occasions boasted of constructing several world-class health centers to address the nation's deteriorating health sector, none has been able to mitigate the existing challenge. The alternative, which is private hospitals, are however too expensive for the average Nigerian to access. With an annual budget of over 400 billion naira, access to basic healthcare has most times proven difficult, even in rural areas, due to lack of personnel or equipment. Nigeria and 4 other African Union countries had met in 2001 and pledged to target at least 15% of their annual budget for healthcare. Many years after, Nigeria remains far from reaching the goal and ranks at the bottom of global health surveys, with its president also seeking medical attention abroad. What then is the hope of the average Nigerian? Joining us via the telephone this morning to discuss this is Ayo Adebusoye, the chairman, BOT, Lagos State Civil Society Partnership for Development. You're welcome to the show.
Good morning.
Good morning.
Yeah.
Good. First of all, why have we been witnessing a surge in the rate of medical trips so far?
Well, nobody wants to die. The first, principle of life is self-preservation. And once we see that the options here are limited, once we see that the level of healthcare here provided is suboptimal, if you have the cash, you go to where you can actually get treated. We see cases again. Late Chief Gani Fawumi, SAN, blessed memory, he had been diagnosed, I think, for some bronchial issue here. Later, it was when he went abroad, he found out it was cancer, but then it was too late. So we have so many cases of the failed diagnosis and of course treatment in Nigeria. So anybody who has the money says they should leave, and we can see. When the chairman of the TTF, Boss Mustafa, famously said that the secretary of the federal government said he did not know how poor the health infrastructure was until the beginning of COVID, because most of the time they fly out at government expense for any small thing. So this is the challenge, and this is why there's that surge in medical care.
Okay, having said all of that, it says, because when Marshall was reading out the statistics earlier, he did say that oftentimes we've heard government boast of, infrastructures, pumping money into the medical sector, but we have not seen any significant change. Why do you think that is?
No, but then how can we say there's been investment? Look at the AU, I think it was mentioned earlier, the African Union in 2001 in Abuja declared that 15% of our budget, of every nation's budget, should be used for health, because they saw the critical nature of the health sector. We need the investment there. But up till date, the federal government has not even reached even 6%. So you can imagine the huge gap. And that 15% is at least, is what they said. So indirectly, you can see there's a whole gap in funding. We have a situation where 70% of health expenditure in Nigeria is out-of-pocket expense, where when we bring it out of our pocket, that we get medical treatment. And this is the most inefficient way of health financing anywhere, where 70%, and that is why you see people reluctant to go to the hospitals, because they know they'll be hit with a fat bill that they have to pay out of pocket. And that is why you see some people even in hospital being detained illegally, because they can't even pay for them to be discharged. So it's a whole absence of health fund financing is actually there, where there has been no investment, very little investment, and the little, that is there, how do we track it? That's why we said everything should be open. And of course, not just the federal government, we're talking about the state government, and even the local government that are supposed to be in charge of primary health care. Where is the transparency in health financing? It's not there.
We have Nigerians, Nigerian health personnel leaving the country and doing very well outside of Nigeria. How do we address the issue of brain drain, especially saying that we have doctors leaving the country every now and then?
Yeah, I mean, my father is very retired, 92-year-old, he's a retired surgeon, urologist, and he's always telling my son, who is in medical school, that as soon as he gets out, he needs to leave the country. Imagine that. So that is what most young students, medical students, those medical graduates, they're all on the way out. Nurses as well, they're in huge demand, because they will go to where they are appreciated. Nobody wants to stay where they're not appreciated. Look at a situation where they are going on strike over 5,000 naira as a medical hazard allowance. It's ridiculous. 5,000 naira for the best brain. To enter medicine in Nigeria, it's always the best in sciences, and they have to go through how many years of study? Many of them 7 years in university. And then after you're now haggling about 5,000 hazard allowance. It's ridiculous. Of course, they'll go to where they get better pay. Now, abroad, how many patients in the Middle Eastern countries? Many of them 4, 5, 6, 7 patients a day, and they're paid nicely. Here, the 100 patients and all, and then they may still withhold your salary at the end of the month. So my father was telling me in 1960, then they used to come and do internship and all from the UK. Doctors will come here to do their residency because they were paid better in Nigeria than in the UK. I mean, so it's not something that is beyond belief to know that we must organize ourselves. It's just organize our country in a way that we actually take advantage of the huge, marvelous brains we have in the medical sector. Look at what they're doing abroad. The top doctors all over the world are Nigerians. They talk medical. Look at how many of them are in Biden's administration. Young people. So where we are saying, if we're not ready to make the condition right for our medical doctors and nurses, especially the younger ones, they'll run immediately. And so the important thing that can be done is we need to decouple the medical, health workers' salary from the civil service salary scale. Okay. They should be paid per hour, and it's paid heavily. They should be paid more than what these are fat cats, I would like to call them, in the National Assembly are getting. That's what doctors should be getting. Because and we can see how important they were last year. They locked everything down, but the health sector had to go on. Yeah. Who remembers the National Assembly at that time? Nobody. Even today, we hear how they've only spent, many of them have just sat maybe 14 days or so in a quarter and then collected millions. So we need to reverse, have a rethink. The priority areas we should focus on health is where we should put money, and education. In Finland, for instance, the teachers are getting the highest pay. We need to reorient ourselves. So medical, the health workers, their salary scale must be decoupled, separated from the civil service structure. They be paid per hour so that they can even go and work in different places and be paid heavily. And the allowances and all should be on a different level than civil servants.
Okay,
that's how we redress the brain drain.
All right. Off the books here, I don't know that universities, tertiary institutions in Nigeria churn out medical students and medical doctors year in, year out, massive number of medical doctors. Do you think that the country has, more health personnel than we can actually cater to?
Sorry, I didn't get that.
Do you think that the country has more health personnel, health practitioners than the country can actually cater to?
No, there's a huge gap. On the contrary, there's a huge gap in human resource for health. We don't have enough. We're understaffed. The ratio of doctors and nurses to the population is much less than what is expected. And that will continue, and it's even increasing for their formation.
What then is the problem? Because we have students graduating from the medical field every year.
Yes.
We have students who have completed 6 to 7 years in the medical field, and they keep graduating, and still we're seeing an issue of
the deficit in the resources.
Come on, what then is the issue?
That's the issue you mentioned. They're fleeing. I told you, my son has not even finished, and my father, who's a retired surgeon, is telling him that as soon as he finishes, he should leave the Met. Nigeria was considered, just in a new report, the second to the last, or third to the last, the least governed country, a governance structure. No young person will want to stay in that kind of environment. You understand? So, medical, all our health workers who are being offered, mouth-watering, conditions of service in times all over, in the Middle East, in Europe, in the UK, in America, Canada, why should they stay? So until we reverse and ensure that look at, there are some states they have not paid the medical in those states. They haven't paid them for months. They are complaining. Doctors, how do you expect this to go on? Every time you hear them on strike, they just stop one strike of resident doctors. They will soon start another one again. Because we have not prioritized the sectors that are important. The health sector is, as we can see now, is a sector you don't play with. So you have to just remove the whole structure from the civil service structure. But that means they're thinking, the orientation and allowances. Pay them, just like you pay the National Assembly people. Whatever it is, all the hardship allowance and all. These are the people getting the hardship allowance, the doctors and the nurses. Because they're in the front line of all the diseases. It's not just coronavirus. There are zillions of other diseases, both the ones coming and the ones that are existing, that they are facing on a daily basis. And nothing is happening. So we really need to have that conversation of how we can start to implement that, whether it's legislation that should be put in place, policies, whatever, both at the federal and state level. We must start that. One of my colleagues, the old classmate, just established a cancer specialist hospital top state of the art in Lagos, Master Root Center. And those kind of things are meant to check, and it has like the best equipment, that, I the best in West African equipment for cancer screening, etc. So those are kind of initiatives that can help check the medical tourism, the flights of both patients and doctors when we have those kind of. But this is a private sector led, 100% led intervention. Government will not do anything. So, and government, in fact, many times even almost block the thing by not giving access to land and all those things for the building. So government needs to take up the responsibility, ensure that even if they're not giving, they should make sure that they make things available for people who even want to come. They came from UK and came to do it here, just to give back to society. And we need more of that. But the kind of regulations, policies that hinder such investment in the health sector need to be reviewed as well, because government cannot do everything. The private sector has a role to play. And our health insurance, that is key. Once we can get our health insurance up and running, like, mandatory, compulsory, then people do not have to pay out of pocket. That will also increase utilization and also increase investment in the health sector through the private sector. So these are what we need to do.
All right, you did talk about policies earlier on, and then a lot of Nigerians are of the opinion that we have public officers travel outside of Nigeria for medical tourism because there's nothing stopping them, right? And then we common Nigerians at the end, we have to, use the deteriorating medical sectors that we have, health facilities that we have in the country, because there's no choice. So do you think that having laws, banning public officers from going outside the country to seek medical attention, we actually put an end to all of this and help improve the health sector in Nigeria?
Absolutely. That should be one of the first. I mean, again, we saw with COVID, when nobody could travel anywhere, we saw how there was a lot of investment, putting up isolation centers, getting oxygen, trying to get here together. When it became clear nobody could go anywhere. So that is something we've always been pushing for years, that all public officers should be restricted, banned from traveling abroad for their families, for any medical treatment. Let them do it here. You can imagine a situation where the State House, with a big budget, cannot even treat simple things, and the president has to travel to the UK, and imagine how much that will cost. So all public officers, and it's very easy to do, and that's why we need a National Assembly that's up and doing, a State Assembly that's up and doing. That's not just a rubber stamp National Assembly that's doing what they actually should do as representatives of the people. That all public officers at the federal, state, and local government level should be, they are forced by legislation to use the facilities in this country.
All right.
And I think, just like in any other country, you don't see the Biden coming to Nigeria or going to Saudi Arabia for treatment. They do it in their country. So if they're the ones supposed to be in charge of it, you'll see things will change. And that should also apply to their schools. They should also go to only schools. Their children should also be forced to go to schools in this country only. Then we'll start to see who is who. We'll start to see how many people want to be public officials. Yeah.
All right. Thank you so much, Mr. Ayo, for coming on the show this morning. It's been a pleasure having you, on the conversation this morning. It was an interesting chat, I must say.
It was actually. I like the last point.
We look forward to more of this kind of chat so we can always, talk about issues, okay?
Great. Thank you very much.
Thank you. Thank you so much, viewers, for joining on the conversation. Don't forget, you can always be a part of it by being a part of our social media community from across all our social media platforms at TOS TV, on TOS TV Network, on Facebook, Instagram, Twitter, and of course, watch the program live on the website www.tostvnetwork.com. And don't forget to subscribe on YouTube so you don't miss out on our amazing content. I am Merciful Ajinomo.
My name is Ade Suwalsi. Thank you for joining us.